Got your mic? You've said that before. David, you be the bookend. We're back. Has everyone finished their lunch? Yes? Okay. Hello again, everyone. And I'd like to now also welcome our webcast viewers. Thank you so much for joining us. My name is Willa Black, and I'm Director of the Canadian Club of Toronto and your host. So if it's trending, we try to bring the headline makers to you. No matter the issue or the topic of conversation, our club makes every effort to bring you experts and leaders who can give you the information that you need to be truly informed. You're going to see that happen today. I think we've gotten the hang of this because we've been at it for more than 120 seasons, and so we've got a lot of experience under our belt. Our events would not be possible without the support of our sponsors, and I would like to thank today's event sponsor, Morneau Chappelle, represented today by Paula Allen. Thank you so much, Paula, for sponsoring and for being with us. I would also like to thank Stingray and David Purdy for sponsoring the participation of the youth and young leaders joining us this afternoon from the Ryerson Leadership Lab. Where are you guys? There you are. Welcome. Thank you. And now it's time to introduce our panelists. CAMH says that 20% of Canadians are struggling with mental illness right now. While so much good work has been done to tackle the stigma around mental illness, we still have a long way to go, not only to ensure that those who are suffering can reach out without fear or shame, but also to make sure that when they do, the services they need are ready and available. There is progress being made. There are solutions gaining traction, new organizations building foundations of passionate volunteers, advocates, and of those willing to share learned experience to help others. There are growing numbers of agencies providing resources and supports, and access to all of this is crucially important for our young people. Discussing this issue further today are Dr. Priya Watson. Dr. Watson is an assistant professor of the Department of Psychiatry at the University of Toronto and a clinician scientist at CAMH. She is also an education scholar at CAMH and a scientist in the Cundill Centre for Child and Youth Depression. Eric Windeler. Eric started Jack.org with his wife and their closest friends 9 years ago after losing their son Jack to suicide. Eric works tirelessly to inspire discussion about mental health and has been recognized for his leadership with multiple honors and awards, including the Champion of Mental Health Award from the Canadian Alliance on Mental Illness and Mental Health. David Willis. David is a director at Toronto's lead agency for child mental health, East Metro Youth Services. His team supports 30 children's mental health agencies across Ontario. Prior to the lead agency, David worked in the brain and mental health program at the Hospital for Sick Children. Moderating our panel today is Christine Birak. Christine is a senior health and science reporter with CBC National News and host with CBC News Network. Her journalism work has taken her to Windsor, Fredericton, and Moncton as a reporter, producer, and host. Christine and our panelists, we thank you for being here, and the podium is now yours.
Well, first off, I want to thank you all for being here, and thank you kindly for having me. I have 2 9-year-olds at home, and when I'm working on stories, sometimes I like to try and find out what they know about a topic or what they think they know. And a few years ago, I asked them, what do you guys know about diabetes? And they both looked at me and they said, did you just make up that word? I've never heard that word before. But over the weekend, I told them that I was going to be here. And I asked them, what do you guys know about mental health? And one of them said, I think it has to do with the health of your brain. And the other said, no. It's about your thoughts and how they make you feel. And I thought, wow, that's not bad. And as Willa mentioned, awareness really has come a long way. When 2 9-year-old boys are starting to get it, awareness has come a long way. And there's a lot of help out there, but a lot of people argue there really isn't enough, and we're not there yet. And I think it's a privilege to have the three of you. All of you are insiders within the system that can give us an incredible point of view. And on that note, Priya, I'd like to start with you. Dr. Watson just came. She's missed lunch. She was at clinic. It seems you seem to be working nonstop. I'd like you to take us into your office. With all of the awareness, my understanding is there is a flood of patients. Who are you seeing, and what are they and their families most commonly struggling with?
So I'm a child and adolescent psychiatrist, which means that I went to medical school, went into psychiatry, and then spent some extra time training to see children and teenagers. And my work at CAMH is predominantly in mood and anxiety, which means that I would see a kid who was referred usually by a family doctor or pediatrician because there were concerns either about their mood or about worries, stress, those kinds of things. The way that it works broadly is that a child who comes for assessment to a psychiatrist receives a diagnosis. That's one of the things that a physician can do that, say, a social worker or a different kind of therapist can't do. And with the diagnosis, then you get kind of queued up for what we think of as the appropriate treatment. So if I said, yep, this 15-year-old does have depression, or this 15-year-old has generalized anxiety, then I would say, here's what we know about what helps with those disorders, and here's what we have available. I remember you said tell a story, and I have none prepared, but I was thinking on my way here about the kid I saw right before I came, who in many ways feels totally representative. So he's been seen off and on since he was about 5 years of age by different people and specialists because he gets really, really mad, and that gets him in trouble at school. So he doesn't listen to teachers, he doesn't cooperate, he throws things, he hits people. Now he's 15, he's not going to school at all, but before he left school, or he refused completely, same things were happening. He was getting really mad, he was hitting people. Then he stayed out of school completely and didn't get out of bed for about 2 months. And he was, part of why I barely made it here is that he was almost an hour late to see me this morning because his mom getting him in to see me was such a struggle. And what he said to me that he hadn't told anybody was that the reason he got into bed 3 months ago and didn't really get out was that he said something really rude to a girl he really liked. And she essentially cut him off. And this boy, who already struggled to make social connections, already struggled with managing his anger, already struggled with liking school in the first place, became severely depressed. And to the extent where he was being brought to emergency rooms because his parents worried for his safety. So he's a very actually typical kid that I would see. And across Ontario, we have data that are telling us that kids are getting more severely ill and more kids are getting ill in these ways. So there's a lot of demand on our service. And I just thought maybe hearing about him as a kind of framework, that's a very typical kid that I would see every day in my practice.
Yeah, I think that's actually a perfect story to characterize some of the obstacles these children are coming up against and the way that they're presenting by the time they get to see someone like you. David Willis, you're the director of Toronto's lead agency for children's mental health. I often hear, and I think a lot of people do, that mental health is a patchwork of services. How easy or how hard is it for individuals and families to navigate the system in order to get the help they need?
Oh, that's a really good question. I think if you talk about children's mental health specifically, we support 30 children's mental health agencies across the city of Toronto. Just in the downtown core itself, there are over 70 funded agencies outside of those 30 that support mental health. And so how does a family understand where to get into that system? How do they understand how to get out of that system? It's incredibly confusing. And so one of the things that we've done to support families in that area is to build a central point of access. So, children, families, physicians, social workers, you name it, can call one number now and connect with a clinician, they can run themselves through a short triage assessment, and then that clinician actually has the ability to triage that client to the best available children's mental health agency that's supporting them around where they live, the services that they need, and the wait times that they have. And that's just in the 30 agencies that we support. So when families try to navigate into that system, now that we're shifting into the Ministry of Health, which is a whole other conversation, but because we're part of this bigger system, I think what we need to do is start really looking at ways to streamline services into it and streamline services out. And the central point of access is a really great example of how we've been successful at that so far.
Mm-hmm. We do hear from a lot of families, I do, when I do mental health stories, about this confusion about where they are in the system and worried that their child is falling through the cracks. And that's a common refrain that I hear a lot. And Eric, I want to bring you in with the perspective of a parent who has lost a child and somebody who has now mobilized a lot of effort to make sure that doesn't happen to other families. What are the most valuable lessons that you've learned in going through the system and coming out the other side?
Well, thank you, Christine, and thank you all for being here. I think it's interesting to have a perspective that's kind of on the opposite end of Priya's. Our story, as Willa indicated, is a little bit different because we had a young person in our family, the eldest of three, who we thought was doing amazingly well. So, didn't start struggling at 5 and have these pretty outward displays of struggle and so on, and got into the university of his choice. Always was near the top of his class. I always say he took after his mother, and our first entrance into the mental health space was a call from a police officer. So it can be at this end of the spectrum. It can also be a completely surprise attack, so to speak. And I describe us as completely average. It's not like we didn't know about mental health a little bit, but we certainly didn't know how to identify those signs and symptoms. We didn't know how to have really in-depth conversations, and frankly, we didn't know anything about suicide. It was the biggest shock, as well as the biggest catastrophe you can ever go through. What we've learned, because we're also on a different part of the system, engaging young people to be in this conversation. So the things that I've learned is the system needs to do more than just talk at young people about the importance of this. It needs to engage young people. And we learned that in our very early days before we incorporated Jack.org and got our charitable status in our partnership with Kids Health Phone. And they were phenomenal to help us to make sure we evaluated our pilot. And one of the things we learned is even when we did that pilot, it was an old guy and a couple 30-year-olds talking at young people. And as far as these high school and post-secondary students were concerned, even the 30-year-olds were old, frankly. Sorry for those 30-year-olds in the room. So that was huge. We were kind of, I went to the first few conferences very early on. I was kind of strange in that sense that I got immediately involved and needed to know why this was possible. And we were kind of tokenizing the views of young people. And we now know through evidence that this peer-to-peer education is phenomenally important. So that's been something I have learned, and we try to share in our work. And it's super important. You need to sort of also bring the balance of those young people's view into balance with the professional views, so that they're also better able to share their views and communicate. And that's why our programs are designed to kind of empower and educate young people, as well as connect them to resources.
I think organizations like yours raise an incredible amount of awareness, and when people do start to recognize signs and symptoms, hopefully earlier than later, there seems to be another issue that families come up against. And Dr. Watson, I'll put this to you, and this was actually sent to me as a message when I had said I was going to be here. Families who feel they are seeing signs, symptoms, or maybe their child is in crisis, they seem to be coming up against two scenarios. The first is they're told their child isn't ill enough to qualify for help. Your child isn't sick enough. On the other end of the spectrum, families are told their child isn't now stable enough to ask for or get help. Are these scenarios that you see, and what are families supposed to do in these cases?
I mean, I'm going to have to just make assumptions about what that means. The not sick enough piece is interesting. Sometimes what can happen, I mean, we're basically talking about sometimes not sick enough. I have heard from families, for example, that the family doctor said, no, this is normal, or no, it's fine, or other people in the family felt there's nothing really to see here, everything's fine, let's carry on. So there are some, I think, pressures, A, that keep kids silent, or B, that, not everyone has a full framework for understanding what sick looks like. So you pointed out so powerfully, it doesn't always look like not functioning. And when we talk about diagnostically, we're interested in two things, in medicine. We're interested in pain and function. And something that hurts a lot, but you still manage to carry on, we're still interested in that as doctors, right? We still want to treat that. But unfortunately, sometimes we just look at functioning, or people around the child or the youth may just look at functioning. So sometimes that can, I guess, influence. The not stable enough, I don't know if this is exactly what's meant by this question, but one of the other barriers that comes up that's a really tricky one is that the kid themselves may not want treatment. And part of the reason they may not want treatment is because of the very thing that they need treatment for. So I'm really anxious and I don't want to do group therapy, or I'm really depressed and I don't want to get out of bed and drive to the hospital and sit there with my mother and talk about my feelings. That sounds like the last thing I want to do, let alone on a weekly basis. So sometimes the illness itself really gets in the way, and sometimes this is the balance that we have in Canada, where the mental health and other legislation says that people have the right to determine what treatment they get, even if you're 10. Right? This isn't, we don't have an age-based criterion for this. So if you're, like the kid I saw today, if you're 15, if you're seriously depressed and anxious, and you're saying, well, I don't want treatment, unless I can say this is going to result in really imminent harm to you or somebody else, I can't force treatment. The other piece is that forced treatment usually doesn't work. So forcing it in the first place doesn't really, is sort of a paradox. So I think, that's where my mind goes when you talk about the too sick or not sick enough, is that those two things are fairly common scenarios that we grapple with.
Yeah, it sounds like for families, that's a hard space to navigate. Incredibly. Because they watch their child becoming sicker and sicker and going into further crisis.
Yep.
And interestingly enough, it feels like sometimes families feel that they end up within law enforcement, closer to the things that happen and hearing from police instead of seeing a doctor. And then they feel like, well, I guess I have to, somehow this will push forward. I want to take a question from the audience, and thank you for whomever has put this forth. I'll open it up. David, I was hoping maybe you could speak to this, but why are more children and youth presenting with mental illness? Do your organizations have a sense of, is it about the stigma? Are more people feeling they can seek support now? Or are we actually seeing a great increase?
Yeah, I think we are. I think that there's sort of two ends that kind of bookend this. One is this public awareness piece where people, the more information you get and the better educated you become about mental health, the easier it is to identify when there may be mental health concerns. And so I think that's happening on a lot of levels across the city and across the province and country. And so when folks recognize that there are issues, they're reaching out more and more for help, which is absolutely appropriate. I think what happens sometimes is that that's throttled a little bit by capacity at the clinical side. So we can have all kinds of people recognizing that they need mental health supports, but if we don't have clinicians who are able to manage those concerns, then we just start building backlogs. So I think, yes, people are absolutely more aware of mental health within themselves, within their friends, within their families, and what happens is sometimes is that those folks in seeking support end up in wait lists or end up in queues that aren't necessarily the most appropriate for them. And so it compounds the problem. Some kids will and families will get in the car and drive past 5 different mental health agencies to get to a hospital, when in fact the hospital may be the most inappropriate place for that family. So, and what ends up happening is that they push that upstream so that there is a bigger backlog. And so it feels perhaps like there's lots of need. I think if we can streamline how people are getting to the services that they need to get to, it will help that. But absolutely, to your original question, yeah, there is a greater recognition that mental health is an issue in our society. Yeah.
And in many ways, it could be that there have been certain levels of mental illness, but now with the awareness coupled with we're just seeing greater numbers of people seeking treatment, which is basically where we start to hit the backlogs. And Eric, I want to come back to you. Given that scenario, you're raising awareness. You're trying to help people understand symptoms, trying to help people within a different space, support one another. How do you feel about raising awareness, but then seeing that it's very hard for these people once awareness is raised to get the help they need?
It's complicated. Just to add a little bit to what Dave has said, the awareness and education is increasing the fact that more people are going to reach out. Right. I think there also is a realistic fact, and Priya would probably know the evidence more than me, but there is also arguably more struggle with this world we live in, this more connected, switched on, 24/7 social media world. Young people today are much more aware of what's going around the world, and I'll show my colors and say the Trump factor, all those sorts of things. It's creating what I call a tidal wave of demand on what we could call a system, but in fact is not really a system yet. There are tremendous people throughout the sector doing tremendous work, but it's not functioning as a really coordinated system. So while it's important to keep encouraging people, especially young people, to be reaching out and reaching out earlier on in their struggle. The stat, to echo what David said, I remember a stat from a year or two ago that 53% of young people were presenting with their first mental health challenge at an emergency room, which honestly is not the friendliest place to go when there's car accidents and you're kind of parked off to the side, and frankly, you probably don't even say what you're really feeling, and you get sent home in many cases. So it's complicated. The navigation piece is huge because everybody, almost without exception, doesn't really know where to go. We could stand outside here on Queen Street and we could ask 1,000 people, and probably 5 of them would know about these wonderful agencies that are there. There's promising signs starting to happen. With the youth wellness hubs in Ontario, we've got great evidence of that being rolled out across BC, for example, now with Foundry. But it's early days, and we want to be much more upstream in our education and awareness approach, but also getting people to build their own toolkits early on so they can be more resilient when they're struggling, and then educate people to know how to support someone, because my turn came, your turn will come. It will come with you, someone in your family, someone close to you, and why wouldn't you want to be ready to support somebody that you care about with this most important health-related issue for young people?
Really, really great points, Eric. I think you raised the political spectrum too, so maybe it's a nice segue into this next question, which is from the audience. David, it's directed towards you, but I think if anyone wants to jump in. So how are organizations like East Metro Youth Services engaging with Ontario Health? So we're talking about money, we're talking about system organization.
I'm squirming a little bit.
I bet.
You know what? It's a great question, so thank you, whoever threw that out there. I'll talk to you later. I think what it means is we're having conversations in this sector, which is now health for us, which we've never had before. And while some people may say that our current political climate is pigeonholing us into a small space that we maybe don't fit into, and that may be right in some ways, but I also think that we are now having conversations that we should have had a long time ago. And if you look at the Ontario Health Team structure, it really is about regional care for everyone in that geographic area. And it makes sense to have hospitals connected with community organizations, connected to grassroots organizations, so that, to my point earlier, when you enter that system, you're not entering 15 or 20 or 50 different systems, you're entering one system. So I think it will force us by hook or by crook into creating networks that ultimately at maturation, which, I would also add is probably 10 years out, we will have a different system to deliver mental health within a healthcare system. Where I think we're going to struggle is if you think about all those silos that have been built over the years, and we talk about education and youth justice and other areas where really frontline mental health happens, none of those systems are geared or ready to talk to each other in terms of how we share information. So, you have hospitals who spend $150 million on a healthcare platform for files, and you have a $500,000 community agency who's now being squished into the same space and expected to talk to each other. Well, that's virtually impossible. So all of those infrastructure issues will become barriers to service if we don't figure it out quickly. But if we can nail that down, that whole idea of entering a system, regardless of where you are in the community, and having the same services coordinated from one end to the other, is actually a pretty lofty ideal that we should all be striving for, I would think.
I want to ask you, do you guys worry sometimes that with all the awareness that's created and we are hearing about funding for mental health, do you sometimes worry that what needs to get done isn't getting done despite the announcements and all the talk? Eric, how about you?
There's no question. It's not getting done fast enough. But to the point of building awareness faster, I think I'm in the camp of increasing the speed of this tidal wave to really get think how complicated it is in this amazing country we live in with 13 provinces and territories and healthcare federated approach. They're not even talking to each other, and there's different approaches, and then we have a change in government in one of those 13, and everything that was done for the last 3 or 4 years, honestly, at the argue being too direct, gets ignored, and we start again with a new approach to thinking about how we're going to do it with our new approaches. So there are good signs. The system change is painful. It's tricky. It's an area that I have a huge interest in, and I'm kind of wondering how we can start knitting the pieces together in a more effective way. In Canada, minor hockey has a better system than our youth mental health system. We got house league for certain kids like mine. We got single A and triple A and select, and people know they go back and forth, and few of them make it to the NHL. There's a system of how it works. I defy anybody. As a so-called expert in the field in one aspect of it, it's hard for me to even describe the nature of the system.
Systems are big, complicated bodies. Dr. Watson, I'd like to bring back a concept.
Priya.
Oh, sorry. I was going to ask
Every
you,
time
but
you say it, I feel a little
what the situation is, but 2 months seemed like, and 2 months is actually really good. But there has been talk that with all the awareness, there aren't enough people like you to actually be able to see patients so that they can start a process. Do you feel that we need more psychiatrists, or do we need more listeners, and what could happen in that space?
This is what I've been thinking about as I was listening to the two of you talk about, and I think it's something generally that isn't as well understood, which is that there's two things that happen, right? There's assessment and then there's treatment. And probably if you could only have one, you'd pick treatment, because it's not all that helpful if somebody like me confirms to you that you have depression or that you have anxiety, or confirms to you that your kid has it, but then you're waiting a further 6 months to a year to whatever for someone to actually help with that, right? So the way that things work now is that, and this is changing, and this is part of what I think is so wonderful about the things like the youth wellness hubs, the drop-ins that are happening coordinated through East Metro. The points of access to care is a different thing than a point of access to an MD like me. So somebody like me can give a diagnosis, and I can treat X number of kids a year because I'm one person. When you have a system where you have whole resources, whole kind of institutions that are emphasize more treatment and less diagnosis and assessment, then you're better positioned to meet the needs. So it takes by the way, 2 months is considered like lightning speed. It's probably 2 to 3 if I'm being honest, and that is like instantaneous. So imagine your kid is depressed and you're told 3 months, and that's amazing. It's a year down the street. So that's considered amazing. That's to get me to confirm the diagnosis. Then there's treatment. So when you tie access to treatment to diagnosis, you often slow things down. So that's why the role of a psychiatrist, I think we're really important in a certain slice, but I don't think we are at all what the system should be resting on. There's very few of us, and we do very specific things. And some of what we do, much of what we do, you can train other people who are less expensive to train, and it takes fewer years to do the work. You don't need somebody like me to do effective treatment for depression. And when we're talking about depression, for example, medication doesn't have a great track record, but therapy has a better one. But therapy has become a political football. So the idea that counseling should be publicly funded is an extremely contentious idea, which unfortunately doesn't link with the evidence, where we know that for both depression and anxiety disorders, the two most common things kids have, it's actually structured evidence-based therapies that make the biggest difference. So I don't think we do need more psychiatrists, because child and adolescent psychiatrists, there's so few of us, and we can do some useful things, and there's just too few of us. But do I think that getting more of us is what's going to transform mental health care? No, I don't. I think it's capacity building around treatment, having properly trained. It's not. I just finished a study where we actually mapped treatment services for depressed kids in Ontario. We've just submitted it for publication. The problem is it's a bit loosey-goosey what's being offered. So is it actually the proper therapy? Has a therapist really been trained to deliver it? Because we know that you have to deliver the right thing to have effect. If you do deliver the right thing, it's effective. So that's where I think we need capacity building, is in properly trained therapists who could be social workers, child and youth workers. They don't need to be psychologists or psychiatrists.
So, David, let's move over to you then when it comes to the treatment and the services. What is, I know there are no easy answers here, but what is one change that you would like to see happen within your realm that you think could make a difference, a feasible change?
Seriously? Hoy, one change. So I think that I would go with it's about access. And it's about access to the appropriate service when it's needed in the place that it's needed. And I think if we can keep that idea as we're designing and planning what the future of healthcare and mental health for kids and youth is going to look like, it will help guide us where we need to invest, and it will help guide us where we need to shift so that we can either move capacity to one side or the other. I think awareness is like we're getting there. There will never be enough awareness, but I do think that once folks recognize or have been supported in finding mental health supports, that we need to ensure that those mental health supports are there when they need them, in the place that they need them. So that would be my biggest wish. I've got a list of about 432 other, if you'd want to.
We'll stick with one.
Okay.
David brought up, thank you. Oh, well, I'll throw one question your way, Eric, and then I'm going to get to some of the questions here. Eric, when you hear there can never be enough awareness, you're doing something now that I think you should share with the audience, a website that Eric has just launched on part of jack.org that I thought is amazing. You know, it's one of those, I think in our lives, we know people who we think are going through something, and we don't really know how to talk to them. Or will me saying something feel judgmental? And I thought watching some of the videos that you guys have put up were incredible.
Well, thank you. Thanks for giving me a chance to talk about this. And I want to shout out that we've got a bunch of students right here, over there, and I got a call out to one over there. Justin Scaini was one of our very first students, and it was his idea to bring our young leaders from across the country back in late 2012 for our first National Jack Summit. We've had 7 of them now. So Justin, thanks for being here. What we do, and I bring that up for a point, is we listen to these young people. Okay, we don't tell them what to do in their communities. You can imagine how that would go over, the young people or old people in Toronto telling the people in the territories, for example, or in Guysborough, Nova Scotia, where I hearken from, this is how you should handle youth mental health. We listen to them. They have the context and understanding, especially when we build their skills. And we have been listening to them, and one of the things they've been saying as we've been doing this work for years now is, well, we are building awareness, we are educating our peers, they are reaching out for services more, but we're not sure how to have these difficult conversations. So we said, okay, well, maybe there's a resource out there. We spent quite a bit of time doing a global landscape scan, and we found a lot of good information, but usually it was kind of hidden on websites. It was kind of in medical jargon. It was a downloadable PDF at best. It wasn't too youth-facing or youth-friendly or youth-voiced. And so the team came up with an idea, and we bounced it off initially, a survey of 1,200 students across the country, not Jack.org students. We did it through a partnership through an agency that has thousands of students. We got these 1,200 responses, and what young people said, they started surfacing the questions that they're having trouble answering when they're trying to support somebody. And interestingly, 83% of them said that they felt they had been in a place where they needed to support a peer or a family member, 83%. But less than about 35 to 40% of them felt comfortable doing so. So there's a large number of them, feeling comfortable about how to have these conversations. And that has ended in this resource that we put this out in a fundraising campaign a year and a half ago, and believe it or not, we quickly raised about $600,000 to finance the first 3 years of this launch. Some from the Ontario government, which has been amazing, foundations, individuals, and it's resulted in something called Be There. Be There is a resource that is meant for everybody. It's particularly youth-facing, and it's voiced by young people, but it's based around 5 golden rules of how you can be there for somebody. And the site is hosted at bethere.org. It's not a fundraising site. It is literally a free resource, and it is attempting to fill a gap, a much-needed gap, between, while you're navigating to resources, even if you know where to navigate, while you're getting your care in the community, or maybe you're in crisis, how to support that loved one. And it's done so with these 5 golden rules and some really engaging videos. It'll be being launched in French by September, and it's really something that we feel will be a game-changing thing. So have a look at it, and it's trying to build off that idea of not only building awareness, but actually helping people in an upstream way to be able to support themselves and those ones close to them, while they're waiting for care. And in some cases, there will be a diversion, and people may not even need to get care because it's early on enough, right? Mm-hmm. You think about it's kind of like an anti-smoking campaign in a way. You don't just go to people when they're 40 and they're at risk of lung cancer because they've been smoking for 20 years. You teach young people, all young people, the importance of youth mental health in this case, and how to be there, recognize those signs and symptoms, and how to lean into what can often be a tricky and tough conversation.
Yeah, for sure. Okay, I want to take a couple of questions from the audience. Priya, this is actually a question that I said I wanted to ask, and you guys said, "Oh, that's a hard question." But here we are again.
I'm ready.
Okay, so how can a minor dictate treatment? So it's sort of that idea of where do the child's rights end and the parents begin, or vice versa?
So, okay. Good question. The way that we think about it and the way that I talk about it when parents ask me that question, like, she's 14, she doesn't know what's best for her, is that, the legal fact is that it's based on something called capacity, which means, do you understand what's being described to you? Do you understand that there's this illness? Do you understand that there's a treatment that could help? And do you understand what might happen if you don't get the treatment? Those are the three kind of ideas around it. There's lawyers in this room, right? So I don't know why I'm explaining capacity to you, but you know this already. So we don't have a minimum age for that in Canada. And sometimes there's some kind of contentious, newsworthy cases. And as somebody, as a psychiatrist, sometimes I feel vulnerable because I do think the child is at risk. I don't think the child is at risk tomorrow, because that's a kid, that's easy. That's a kid I send to hospital, right? It doesn't matter what they want. I do think their risk is elevated. They don't want to get treatment. And I feel vulnerable as the doctor saying, I can't force this. And I've had parents very upset with me in those circumstances, and I can understand why. What I can say on the other side is that forced treatment, by the very nature of what the treatment is, can't work. Because the idea, I mean, you could take an essence, you could take Prozac, for example, and it would probably do something, irrespective of your attitude toward Prozac. But unfortunately, Prozac doesn't work all that well. It's got like a 30 to 40% response rate in adolescent depression. So that tells us about 2/3 plus of kids. It won't help them anyway. So what does work is psychotherapy, counseling, but you have to take that in. And so if you don't want it, then the medicine of psychotherapy can't work. So it's unique in this way, I think, mental health care, and it's frustrating and it's often sad. But I've had the experience, and what the advice I tend to give frequently is, I hand over autonomy in every way that the reason the kid today told me what he told me that he hadn't mentioned to anybody else, for example, is I made it very clear within the first 2 minutes. He came in like this and the hoodie was up, and he literally wouldn't tell me his name, his age, anything. So I immediately asked his mom to leave the room, and I said, should we just stop? I don't want to force this. Did you get dragged here? And that is the process of engagement, which takes time and sometimes doesn't work. But it's the foundation then for the successful treatment and care. So I don't know, that's a long-winded answer, but it's a complicated scenario.
It's a complicated scenario. Okay, this is the last question, and I want to make sure we get it in. And we did touch on this a bit, and I'll let any of you who wants to jump in. Do you see a role for life coaching in preventing and helping people with navigating the society that we live in? So maybe this is taking even a step back and saying, and Eric, I think you touched on this, can we better support one another? Is there a real role for life coaches in our modern society? Well,
why wouldn't all of us want to be able to coach a young person about how to better support their mental health? If we had only known, how to learn about mental health, how to look for those signs and symptoms, and how to have those conversations. One of our board members, I can't remember what he calls it, but he calls it dinner unplugged, I think, which could be a very important way to sort of coach one another. And another thing I think that's really important for the parents in the room is how often do we share our own struggles back in the day or currently? I would argue that we mainly talk about how well we overcame things and how strong we were and how well we did. We don't naturally have those vulnerable stories, which promotes an honest exchange amongst us all. And so part of that coaching is that two-way thing to get people, and it doesn't happen in one conversation at one time. It may happen different with your two boys. It may happen one way with one of them and one with the other one. You have to look for those ways and make it something that's just ingrained with our conversation, because it should be. It's not when they come home, how'd you do on that test and did you win the race, which is probably, I'm paraphrasing, but it's kind of that sort of expectation-based thing. It's really got to be genuine and from the heart and vulnerable on your own side to be an effective coach and be there for somebody.
Mm-hmm. Genuine, real conversations. Thank you all for your questions, and thank you all for your candor and taking every question with grace.
You got that.
I think they deserve a round of applause. So I think we'll all agree that was a smart, thoughtful, and powerful panel. And Priya, right off the top, you said something that just really stayed with me. Not everyone has a framework for what sick looks like, but if you know something is wrong, then seeking support is a positive and an important first step. Christine, you framed it perfectly when you talked about the fact that with increasing awareness comes increasing demand for treatment and help, and we've got a system that's under stress right now. Young people are under all kinds of new pressures, and we need a better and more coordinated system of support. So it's a good thing that you're on the job, David, and trying to make sure that parents and families do have that single point of access and triage. So keep up that amazing work. And as you say, Eric, we can all help, and why would we not want to be ready to help a young person? Thank you so much for the incredibly important work that you do to make sure that parents, peers, family are ready. And I would encourage everybody to go to bethere.org. I was on it the other night for about an hour. It is absolutely fantastic and such an incredible resource. So please tell all your friends and family and any young person you know about it. I think the bottom line for me that I took away today is that we're not getting the job done fast enough. So perhaps today we've gained 130 new advocates for change in this room who can press to see the kind of action that we need to take to really support the next generation, because the next generation are counting on us. So thank you, Priya, Eric, and David. And Christine also for leading this charge. You know, you're right, Priya, there are too few of you, but thank you so much for all that you do, and you guys keep your foot on the gas. So to our moderator, Christine, you were the perfect choice to lead today's discussion with such empathy and such clarity, and I know how hard you did your homework, so we really, really appreciate it. It certainly showed. So thank you all again. Now I go from the sublime to the necessary. This is always a really awkward transition, so stay with me. Before we conclude, here are some highlights for upcoming club events. On Tuesday, May 28th, the club will host the President and CEO of Infrastructure Ontario, Aaron Corey, who will talk about modernizing the province's public assets. And on Tuesday, June 4th, we present the 2018 Lifetime Achievement Award to the Right Honourable Brian Mulroney, Canada's 18th Prime Minister. So that will be a wonderful day. We hope you can attend. And before we wrap up, I'd once again like to thank Morneau Chappelle for sponsoring this wonderful discussion. Thank you so much, Paula. And I'd also like to thank MediaEvents.ca, Canada's online event space, and VVC for live streaming today's event. So thank you, everyone, for being here. I hope you can now go back to your jobs and your work or your whatever it is you're doing this afternoon more invigorated, and we very much appreciate your taking the time to be with us. Enjoy.